In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Hemothorax. So what is hemothorax? Hemothorax by definition is accumulation of blood, blood, and this is in the nothing but the pleural space. And the most common cause is nothing but the trauma. The most common cause of the massive hemothorax, it can be due to the torn intercostal vessels, and this can be due to the secondary or to the rib fracture. Now, clinical features, it can use the dyspnea, tachypnea, as well as the reduced BP and the dull note on percussion, as well as the absent breath sounds. Next is how do you diagnose this? So diagnosis of this is by the needle aspiration. So you can do a needle aspiration. Next is of the pleural fluid, needle aspiration of the pleural fluid. Next will be the chest X-ray to assess the presence of the extent of the pleural fluid collection. Next is management. How do you manage? Is by the insertion of the ICD. And looking at the triangle of safety boundaries. What does it include? Triangle of safety, it includes anteriorly the lateral border of the pectoralis major. So lateral border of the PM, that is the pectoralis major. Next is the posteriorly, it includes the lateral border of the latissimus dorsi. So lateral border of the LD, latissimus dorsi. Next comes inferiorly. Inferiorly, it includes the lines of the intercostal space. So the line of fifth ICS, intercostal space. Then moving on, let's look at the superiorly. What do we have? So superiorly, it is nothing but the base of axilla. So superiorly, base of axilla. Then there is a lateral edge of the pectoralis major. Then comes a fifth intercostal space, as well as a lateral border of the portissimus, edge of the latissimus dorsi. So superiorly, we saw the base of axilla. Now, indications of surgical innovation, it includes the 1500 ml of the brain blood damage, the blood drainage, and this takes place in the 24 hours through the chest tube. Next is 300 to 500 ml per hour. 300 to 500 ml per hour for 2 to 4 consecutive hours. And this is after the chest tube insertion. Next is the great vessel or the great wall injury. Great vessel or the chest wall injury. And also in case of the pericardial tamponade. To learn and grow daily like this, please do subscribe.